Doctor, I would like to do some examination on you. Is it okay for you?
So the doctor wants to do the relevant general examination. Now I want to tell you here that the relevant general examination can be done before or it can be done last of all. The choice lies with you. Whether you want to do first general examination or you want to do last of all relevant general examination. So please proceed and do the relevant general examination with the patient.
Can you give me your hand? Okay.
So she is looking for any palmar erythema. You have to show them, you have to move this side, yes. Yes, like this, yes, exactly. So looking for any palmar erythema. So she is also looking for any clubbing of the fingers, because there will be acropathy in case of hyperthyroidism. And
The hand is feel warm and hot
so hand feels warm and hot
and sweaty.
and it feels sweaty. There will be usually in hyperthyroidism excessive sweating, as well as there will be generalized, the patient will have generalized wasting of the muscles. The patient will look lean and thin in case of hyperthyroidism, while as in hypothyroidism he will have obese look. The face will be swollen. The skin will be thick. While as in case of hyperthyroidism, the patient is usually overactive and has got lean and thin build because of excessive catabolism. Yes.
They'll check for fine tremors.
So she is checking for fine tremors. So that can be done by eyes open and eyes closed. Eyes open and eyes closed. So you can put the paper and see if there is any tremor. So you can see the fine tremors is present. Okay. Then
I will check for the pulse.
so she checks for the pulse.
Pulse is 105.
So pulse is to be felt for at least 1 minute. The ideal is 1 minute, or you can feel it for 30 seconds, but ideal is 1 minute. So she says that the patient has got tachycardia, it is more than 100, which is a feature of hyperthyroidism.
I would like to check for the blood pressure also.
So she wants to check the blood pressure because in hyperthyroidism the blood pressure is usually high. Then what else? What else for the peripheral signs? So she has to look for any peritibial edema. So look for peritibial edema. So she looks for any peritibial edema. We see the skin is normal. We don't see any peritibial edema. While as in case of hyperthyroidism, there can be the legs can be swollen, non-pitting edema. Sometimes like elephantiasis. So much the legs will be swollen. So we don't see any peritibial edema in this patient. Okay. Then what else you will look for as far as this is concerned, what is called as far as peripheral signs are concerned, we look for reflexes. In hyperthyroidism there will be hyperreflexia. In hypothyroidism there will be hyporeflexia or delayed reflexes. So when we check for deep tendon reflexes, we find that there is hyperreflexia. So anybody has got the hammer? Give the hammer? Yes. Okay. So you can check for any you can elicit the reflexes. You can check the biceps reflex. You can check that arm first. You can check. Yes. So it is to be done like this. Let me show. It is to be done like this. So slightly flex it, slightly keep it slightly like this, and then do it. So I can see. You can see the reflex. The reflexes in this patient is normal. You have to see all the reflexes. You have to check for the triceps, like keep it like this, and check for the triceps also. The reflexes in this patient is normal, and check for the ankle reflexes, especially the ankle, the slowed and delayed reflex, especially of ankle reflex. In case of hypothyroid. So we see here the reflexes are not slow or delayed, they are normal reflexes. In hyperthyroidism, it will be hyperreflexia. That was the another sign we elicit as far as general examination is concerned. Is there any other you will do as far as general examination is concerned? Okay. So check for any proximal muscle weakness. Proximal muscle weakness. Now proximal muscle weakness should be done. If you are doing lower limbs proximal muscle weakness, then patient should be able to get up from the sitting position unsupported. He should be able to stand up himself without any support. Now how to do that? That you put both the hands on the head like this, and then you try to get up, or you put hands like this and then try to get up. Now we got a here. He will show you how it is to be done. So please put the hands here like this and try to get up. So he can get up. He doesn't take any support, or he is not unable to get up. So he doesn't have proximal muscle weakness of the hips. You understand my point?
Yes.
And the upper, you just raise it like this and raise down. So raise up again. So we don't see that there is any proximal muscle weakness or proximal muscle myopathy in the patient. Meaning that in case of hypothyroidism, the hypothyroidism patients, they have myopathies also. Okay, done. This, then we see the peripheral signs, right? So in hyperthyroid, there will be hyperdynamic circulation. The pulses will be high bounding pulses. You understand my point? So you check the peripheral sinus. So peripheral sinus will be first in the hand. So check the hands. So you look for hands, any wasting of the muscles, because in hyperthyroidism there will be wasting of the muscles. If you see in this patient, you can see the muscles are wasted. He is lean and thin, means there is more of catabolism going on. In hyperthyroidism, the people will be lean and thin, while as in hypothyroidism, they will be edematous. You understand my point? So in this patient, we see that the muscles are wasted. Muscles are wasted, and we also can feel that hands are very warm. Hands are very warm, and they are sweating. And I can also feel here that he feels hot. You understand my point? He feels very warm, right? Like this. And then I check for any clubbing, because they go for acropathies. So I don't see there is any clubbing in the hands. You understand my point? But there is a deformity. If you see, there is a deformity. The swan neck deformity is there. You can see here. And there is some ulcer, right? And then we look for the pulse. So in the pulse, we will feel the pulse. The pulse is high volume pulse, right? And it is around, just show me the watch. It is around 110 per minute. It is regular in rhythm, and it is high volume, right? And if you see here, is there any pulsation here? So you can see the brachial pulsation here. This shows that patient got hyperdynamic circulation. So in hyperdynamic circulation, you will feel the brachial pulsation, you will see, right? And if I feel here, I find this as high volume pulse, right? And then these patients, they sometimes come with arrhythmias, they come with atrial fibrillation, right? These patients have atrial fibrillations. Okay, after the pulse, we check for BP. The hyperthyroid patients will be having their BP on the higher side. They will be hypertensive. And then look for tremors. So ask the patient to, yes, like this, feign this thing and close the eyes. Close the eyes. Okay, so you can see there is tremors, right? So we see the fine tremors. Right, so fine tremors is elicited. Patient has got tremors, which is also a feature of hyperthyroidism. Okay. Okay. Then what we will see in the peripheral sinus? Then we also look. We just checked the pulsation. So we have to see if patient has got JVP is raised or not. Right. So at the moment we won't do that examination. Our examination will be relevant to the thyroid. Right. I won't as such do whole examination of the CVS. So anything else we will check as far as after the tremors, any peripheral sinus. Then we will see the check for the eye signs. So the patients with hyperthyroidism, they will have eye sinus. The first eye sign will be that we will look for any lid retraction. So we don't find. Right? So ask him to look here. Yes, at your finger. Show the finger. You keep it as 40 centimeters. Ask him to look. Stabilize his head like this. We don't see there the palpebral fissure is widened. We don't see there is lid retraction. If lid would have been retracted, then it would go like this. You understand my point? Normally the upper lid will, the limbus will be covered by the upper lid as well as by the lower lid. In the upper lid at the position of 11 to 1, and in the lower it will be at the position of 6 o'clock position. You understand my friends? So this lid and this lid will cover the limbus, but here it is covered, the limbus is covered. But if it is the hyperthyroidism, it will be like this. You just see here. See, the limbus will be, the cornea will be exposed. Then we say it is a lid retraction. So this patient doesn't have lid retraction. Then we see if there is infrequent blinking, if there is absence of blinking. In this patient we see there is blinking. So there is no staring look. You understand my point? There is no staring look, and blinking is also normal in this patient. Then we see any lid lag. So lid lag is to be done like this. So ask him to see the finger. Okay, so you can see here. So his lid comes down, isn't it? So then it goes up, then it comes again lid down. So there is no lid lag. If there would have been lid lag, either the lid will not fall, it will not pursue the finger, right? Or it would be very slow. So we don't have lid lag in this patient. We don't have the staring look, and we don't have infrequent blinking. So this patient doesn't have those signs. You understand my point? Then we see what is called as the convergence, whether there is any loss of convergence. In hyperthyroidism there will be loss of convergence. So you bring the finger like this, ask him to focus at the tip of finger. Okay, then ask him to look at the tip of finger. So you can see the convergence is there, isn't it? Both, it is, the eyes are like this. You understand? So see now. So now the eyes will converge. Check. So eyes are converging. So the convergence reflex is normal. So we don't see that also. This is called as, if it is absent, if convergence is absent, we call it as Mobius sign. We call it as Mobius sign. Is there any other sign you would like to see? Any, if there is any loss of wrinkling of the forehead, so ask him to look there and look the finger and ask him. So we can see both the sides there is wrinkling of the forehead. You understand it? There is no loss of wrinkling on the forehead. So Joffrey's sign is not present. You understand the point? Is there anything else? We look about the proptosis. If there is any bulging of eyes. Now if you see in this patient, look here, we don't find there is any bulging of eyeballs. There is no bulging of eyes. There is no proptosis or there is no exophthalmos. That can be observed also by going behind the patient and look from top. So look from this side and see if the eyes are bulged out. So in this patient we don't see there is any bulging of eyes. So we don't consider in this patient exophthalmos or proptosis. You understand my point? Yes. Any other? So we also look for any myopathies. Now myopathies is that the patient should be able to get up from the sitting position. If we ask him to go there, right, and stand from the sitting position, then he should keep the hands like this and he should do like this. If he does like this, right, he sits down on the floor and then stands up like this, keeping the hands like this or keeping the hands like this. He should be able to stand up without support. Then we will say that he doesn't have myopathy, he doesn't have proximal myopathy. Now proximal myopathy is in the upper limbs. Now you ask him to again lift the hands like this. Okay, so he can lift it, right? So there is no proximal myopathy in the upper limbs also. Yes. If you see in this patient, we don't see that legs are swollen. In case of hyperthyroidism, the legs will be sometimes very much swollen, right? And they will be edematous. So we call it as pretrivial edema, non-pitting edema. So we don't see here the patient is having any edema or patient has got any pretrivial myxedema. Rather we are seeing there is darkening of the skin and the hyper and hypopigmentations, and we see that there is a wasting of the muscles. So in spite of his good appetite, he must be losing the weight and he must be losing the muscles also. The muscles are getting atrophied and wasted. So these are the peripheral signs we look for. Then last of all, we check for reflexes. In hyperthyroidism, there will be hyperreflexia. So you can check. You will check or I check. Okay, give it to me. Now if I put the hand like this, you understand my point? I put the hand like this, right? So I check for any hyper. So you ask him to. Do you talk to her? You talk to her. Go on talking to her. So see. Okay, so we don't see hyperreflexia is there, right? The reflexes are not brisk, reflexes are normal. You talk to her, keep her busy talking. So this is for triceps. You ask him, don't do anything. So the reflexes are normal in this patient. There is no hyperreflexia. This is what we do. We check. Then we have to check the reflexes of knee. Okay. Atrophy of the muscles, the suprascapularis muscle wasting, right? Then you can see here the deltoid muscle wasting, triceps muscle wasting. The whole body has got wasting of muscles, which is a feature of hyperthyroidism. Okay. And if you see, this patient is also lean and thin, again a feature of hyperthyroidism. While as in myxedema, they will be very edematous. Their face will be swollen. Okay. Check whenever there is a hyperthyroidism, we have to check the cardiovascular system, because this hyperthyroid patients, they will have cardiovascular complications. So it is better that we auscultate heart and see if there is any murmur, right, or there is any abnormal sounds. So you check here. So I find that S1 and S2 is normal and there is no murmur, right? And then you have to also check on palpation. You can see here the apical impulse is here. This is the second, this is the second, this is third, fourth, this is fifth. This is fifth anterior axillary line. The apical impulse is here felt. So patient has got cardiomegaly. Then to complete the thyroid examination, we have to check the chest also. So very nafas. We have to look for any cryptations or any signs of effusion, because these patients, they come usually with left ventricular failure or right-sided heart failure, so it will look for any cryptation or any effusion. So this patient doesn't have any signs of cryptation or effusion. Okay, so that finishes the examination of the thyroid. We're now concluding here. I must say thanks to all of you. Thanks to Mr. Lee, right, who himself presented as patient, right, and it will be a good contribution when the others will see this video. It will serve for the educational purposes, right? And I thank all the guys who came as examiners and who examined the patient, and I thank you also who showed us the video background. Then our usual the camera operators, I also thank them, right? I thank you all. You have been always supportive, right? And you have been very enthusiastic, and you got a very keen interest in learning. I hope in the future, by the grace of God, you will prove very good doctors and you will try to minimize your mistakes. That will be my hope. So I thank you. So give a big hand to the volunteers. I thank you all and all the best in future.